Welcome to the Joyful Giles podcast. She's Vanessa.
And he's Quentin.
Yeah, I did that.
I see what you did. You see
all
how I
right.
was like,
You were ready. I didn't know if you was going to be ready or we were going to have to do a retake. How are y'all doing today? So happy to be here with you. Happy to be here with you too, my love. Yes.
my sweet husband.
Talking and whatnot to the people.
Yeah.
So, lots have been going on in the world, in our country, in normal day to day. One thing I can say confidently for sure, no matter what is going on, the Lord is a keeper.
Yes.
That nature of him is unchanging.
Yes.
He is a keeper.
Yes.
And we have had experience after experience of just being kept by him, and particularly when it came down to the birth of our daughter.
Yeah.
So y'all have heard us give Easter eggs about how difficult and stressful the birth was, or traumatic it was. And we've never really fully talked about it on camera. Family knows, friend knows, but we thought we would discuss that whole situation and ultimately how the Lord kept us.
He taught
through.
us.
Yes,
He
indeed.
taught us that he would keep us.
When it's tough and unfamiliar, all the things happening.
Things.
So
So the story will span from the week before I had Alea, the birthing story, and then the afterbirth of how the Lord kept us.
So what happened the week before you had? Let's set it up real quick. I know you said the story would be there, but the pregnancy,
It was
pleasant.
It was considered geriatric because I was 35.
Old goat.
Bah.
It's an inside.
It is.
It's an inside joke.
I also had chronic high blood pressure issue that I was actually getting to a healthy space with through medication. But I was in the gym, doing all the things, and then we get pregnant. There were just a lot of things to monitor, which I think because of those two things, with my weight at the time, my age, and the blood pressure history, it was also considered high risk. So we did see a high risk doctor, but that wasn't until was it the full pregnancy or just after the first trimester?
It was after the first trimester.
Yeah.
We saw Dr. Odie 1 through 3. And then we went and got a high risk.
After that. So that's
But largely, it was fine.
It was a great, I didn't have the diabetes. I never went into pre-eclampsia, none of that. It was pleasant.
So take us to the week before the delivery.
So
what happens?
Our delivery doctor at the time wanted us to basically not carry to full term, like the 40, 41 weeks. She preferred that I give birth around 38, 37, just because she didn't want my body to start reacting in a certain way or my heart to be too worked. So it was always in the plan, if you will. I did start having spikes of high blood pressure every now and again. She made the decision to put us into, is it anteparty? Am I saying it right?
I don't know. They admitted her. I don't remember what the wing was.
It's the space where women are still pregnant and they're being closely monitored in the hospital, which I think is called I'm going to look it up, y'all. But yeah, I was there for a full week. I was there for an entire week, which I am so thankful for. Quentin was there. My mom came. My good friend Natalie came and visited me for a while. Antepartum. Alea was doing fine. Honestly, we're just kind of waiting on the doctor to say, hey, when they have a birthing suite, we're going to break this water, put you on a little Pitocin, and get this party started. By God's grace, we did fine that full week as far as my heart goes, and Alea did okay as well. And I remember, y'all, again, this is like day 7. Quentin was like, I think I want to go home and sleep in my own bed tonight.
Correct. As much money y'all charging for these babies to be delivered, you should have a comfortable couch. For the parent, or if they mama come, their guest.
He was like, my back can't take it another day.
This ain't gonna work.
So he went home. He went home. And I think he was there for like an hour or 2.
I don't think it was 2 hours. I went home and it was basically like, come back. We're ready.
I was like, they just called me down to a suite. It's time. He was like, what? He was upset.
Annoying. It was annoying.
Just the fact that he knew he was going to have to spend another night really uncomfortable.
It's because I had decided I'm going to go home now. I'm going to go home. I've been up here. We've been here all week. Ain't nothing happened. I'm going home. No, you're not. Come back.
We get to the delivery room, suite space, and they're letting me know that they're going to put me on Pitocin and that we're going to see what happens there. Just trying to get things to gradually kick up. The plan was always to break my water, but just not that soon. She just wanted to see what my body would do on its own. Day 1 goes by. They try putting in a little I don't know, pill that helps you dilate a little bit more. And they turned up the Pitocin. And the Pitocin got to a point where it's like, baby girl is not budging. They're like, she's not budging. And they proposed the balloon. And when Quentin and I were researching what kind of birth we wanted, I decided I didn't want a C-section. I wanted to give birth naturally or vaginally. From the reviews I kept seeing and reading from women who had the balloon, they were all discouraging it. They were overwhelmingly discouraging the balloon.
So let's explain the balloon.
Yeah.
Balloon is deflated. They insert it into the cervix, or they insert it, and they manually expand it in order that the cervix would expand so that, you can dilate and get the birthing part.
To trigger your body to start.
Correct.
The largest at the time that it went was 4 centimeters. So that she put it at the highest, they gradually increased it. And so that was going okay. Didn't really have a lot of issues. It's just that Alea wasn't budging. Like, I was not dilating at all. I wasn't, nothing was moving at that time. And I think it came time to the maximum amount of hours that it could be within my body, and it was time to take it out. And our doctor at the time asked, with these things, whenever your body is at a certain dilation, it'll just slip right out. And she was like, I wonder if I just give it a hard tug, that it'll just come right out. I'm pretty sure it'll come out. She said something along those lines.
She said she was going to see if it came out.
Quentin has to help me with pieces of this story, especially after this moment, because this is when it ticks up. Our doctor at the time made the decision to give the balloon a hard tug.
No, she tugged it first. It didn't come out.
Oh.
And she hard tugged.
I guess she tugged it, yeah.
It didn't come out.
I just remember screaming and crying. I don't even have words to describe the pain, but it was very bad.
The doctor said that she was going to tug it, see if it came out. It didn't come out. And then she yanked it. And you let out a scream like I've never heard you scream before, because you scream a lot.
I do not.
She see a spider.
Not that kind of scream.
If you see a spider, you scream. If you hurt your elbow, you scream.
You're driving.
You're always elevated.
I've told you that so many times.
I can't tell if it's an axe murderer or what.
I'm the drama when it comes to
Very much so. I told her this because she would just be screaming. In the car, I'm like, I can no longer gauge what type of scream it is because they're all at the same pitch. So you basically are out here sheep amongst wolves, because I can't go into action and then find out it's basically nothing.
Gasps.
No,
I will go, oh my goodness.
It screams. So this scream was different than all the other theatrical screams that you have done.
Extremely painful.
Yeah, it sounded that way. It was like a blood-curdling scream. It sounded really, really bad. You screamed really, really bad. I could tell you hurt. And then you started crying. We paused that. We tell her, I think we asked them to deflate it.
Yeah.
Or she decided to
she had to. It was time for it to come out.
She had to deflate it. So this tug was not deflated. This tug was at its full
maximum
expansion. And in theory, the first tug, I understood what she was doing, because if it'll come out, that means you're at a certain centimeter. And then also that means, maybe baby can get all the way through, right? The second tug, it was a yank. The first one was a tug. The second one was a yank. And it still didn't come out. So you basically shut down everything at that point. You was like, get this out of me. We're not pushing. We're not doing nothing.
No. I was so upset. I
think you even told them to cut the Pitocin down, because at that point you were still on Pitocin.
No.
Contracting.
No. I was like, shut it all down. I need a moment. And in those environments, it's not really welcome. They say, it is, but it's really not.
Environment.
Yeah. And
you say it's not welcoming? What do you mean?
It's like for you to slow down whatever they're trying to do to progress.
Because they're trying to get the kid
to
in
keep
there.
it going.
I used to work in the hospital. We got to flip this bed. We need this bed for the next one.
Well, that's how we feel. She ended up coming back and explaining we can't reverse the progress that we've made, but you've created a traumatic moment for me. Now in my mind and my heart, I'm drained. That was a lot.
Mind you, we had already been there a day and a half. We
2 days.
We were going on 2 days by the time they did that. So they had already kicked the Pitocin in.
We had her on day 3.
Correct. So you had already been contracting for a day and a half, going on 2 days when we do the balloon pool.
Yes. So I was like, I need sleep. I need to let my body recover. We also called some really good friends. My mom is a nurse. She had another friend who was a nurse.
We called the lady we knew at our church who was a doctor, who was a OBGYN.
Yeah, at our church. We just got some counsel on what to do. Because at that moment, it's like, are we even in the best care at this point? Because that was just not it wasn't best for me and baby. So they advised us what to do, and they agreed with my decision to shut things down and give my body an opportunity to reset. They did say, don't wait too long, though. I remember the doctor telling me early in the morning, was like, we have to keep moving. She was like, we're going to lose these centimeters that the balloon, which was just 4, and I was still 4 centimeters. The next day, even after some rest, they offered more things to kick off the birth. She did break my water at that point. That's what started those contractions. That's when everything got tough. I did have an epidural maybe right before that began, because I didn't get an epidural right away. Right when she broke my water is when they started kicking up, and before they got unbearable, I got an epidural. That was a pleasant process for me.
But even that, the epidural started wearing off. Or you only felt it on one side.
On one side of my body.
Yeah, it started well, but then it was only one side took it every whatever, I don't even know how long, every 45 minutes, every hour or something. Setting an alarm to get up to hit the button.
To keep me in a space of like comfort.
Correct.
You know, there are delivery nurses who come in and out. We had 2 really great nurses. The second one, though, her name was Miss Ginger. We will never forget her.
Shout out to Miss Ginger.
Shout out to Miss Ginger. And so I remember we kind of got on the prayer line, y'all, because at this point we going on day 3, 2 going into day 3 of we in labor, and now I'm in pain. The issue, she finally told us the truth. The issue was that the space where the balloon was pulled actually caused some bruising and inflammation.
On the cervix.
On my cervix. She then posed an issue for Alea's head to come through the birth canal. They were just really waiting on me to dilate more, but I guess my body was just still in such shock.
Slow boogie.
Yeah. So she's turning me, and somewhere down the line, we got on the prayer line, and she was in the room with us. She was like,
I think she walked in.
Yeah.
We were praying with somebody.
Yes.
We was on the phone praying with somebody or some
forget
people.
who it
I don't know
was.
who.
Yeah, I can't remember who it was. And she was like, my brothers and sisters in faith, and like came and joined in with us and prayed. And she said, I always ask the Lord, please assign my assignment today. She said, I never rely on my charge nurse. I always rely on the Lord. And so I know he sent me here.
What she said was, the charge nurse thinks that she's making my schedule, but the Lord is the one that's guiding her. And I'm praying for where I'm supposed to go each day. And Miss Ginger, we'll never forget her, Miss Ginger.
And the Lord sent her to us.
Sent her.
Many more hours went by, no Alea, no more progression. I probably was up to maybe 6 centimeters at this time, but it had been hours. We're now in day 3. The doctor on call came in and was like, hey, we're going to start prepping the OR. We need to do a C-section and get you out of here.
Yeah.
I with tears in my eyes, I was like, I really don't want to do that, but okay. Because if it's a danger to me and her, okay. So Ginger goes to lunch. She goes to lunch, and I forget what happened. Something happened while she was on lunch, and we ended up calling her. You don't remember that?
No, she just came back.
When she came back, she said, I've got an idea. She said, this is what I want you to do. I want you to take this Benadryl, and we're going to wait an hour, and I'm going to check you. And if you're at the place you need to be, then I'm going to ask you to cough really heavily, and I'm going to actually physically
open your cervix.
Yeah, and push it over Alea's head, I guess.
Yeah, push the cervix over Alea's head.
She said, and then we'll be ready to push. She said, when that happens, I'm going to need you to gather whatever strength you have, because it's going to be go time. And I said, let's do it. Let's do it.
Mother went to lunch.
I think she went to pray. I believe that. To ask, what do I do in this case?
Yeah.
So that's what we did. I took the Benadryl. It worked. Whatever her plan was, it worked. And directly after we pushed, I think we pushed for
maybe like 40, 45 minutes or so.
Okay. I don't know.
Well, maybe about 40, 45 minutes. I mean, because she came back and she was, she did it. I mean, we couldn't see what she was doing, but she
did whatever she said.
Yeah. And then we got the pushing, and then our doctor ended up coming back. I actually don't know where our doctor went. This is the same doctor that did the yanking of the balloon. The on-call doctor was the one that said we were going to do a C-section, but then when things got in motion, our doctor ended up coming back. Her office was located across the street from the hospital. So she came back and
it was go time.
It was go time.
Yep. So I guess 45 minutes later, because I don't remember it, y'all, Alea was there. I don't really remember feeling anything. I just remember being completely deflated. I wanted to sleep. Like, that's all I wanted to do. I remember Ginger grabbing us and praying and saying the Lord kept us and that she was thankful for having an opportunity to serve us. I'm going to cry. Oh. And we ain't seen her since. But yeah.
She delivering babies, baby.
Yeah.
Ginger's at work.
And she's on the Lord's side. It was a Caucasian woman with ginger hair named Ginger.
Nurse Ginger.
Nurse Ginger. And I'm extremely thankful for her because I really feel like she intervened in a big way. The Lord sent her to intervene in a big way.
Yeah.
So something my husband did is he wrote out like 6 different scriptures about children, strength and trusting in the Lord, and taped them to my hospital bed. And like when it's tough, just remember his word. So that also helped me a lot. Thank you.
The Lord is kind.
Yes, he is. I was like 3 years late.
What a tear. We ain't seen no tear. We want to see
Your eyes.
The people want to see tears.
Okay, all right.
Zoom in on this tear here.
I'm fighting them because I'm trying to continue to talk.
Fighting the people need to see that.
Because if I let them flow, I ain't gonna be able to talk.
Okay.
See, I'm gonna catch them right there. Right there.
Okay, be caught.
Okay, y'all. So we had Alea. We did the aftercare. It was very traumatic. I had a 2nd-degree tear, so my doctor sewed me back up.
Really, we wouldn't even have that. Ginger was guiding the pushing, and our doctor got there towards the end.
Yes.
And so Ginger was on one leg, I was on the other leg. And she pushed. What I recognized was Nurse Ginger was having you push
During my contraction.
at the flow, and I don't know if I'm saying that correctly, but at the flow of the contraction. So as she was looking at the monitor, as the contraction hit a particular space, she would tell her push. Okay, guide, push. And so when the doctor came in, the doctor took over, and it was still that, but she then began having you push even if you weren't contracting. Because you end up asking, you push now? Because we had a certain rhythm of when you were pushing.
And I was trusting Quentin and Ginger's voice at the time. I remember her saying, push, 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 push. And I was like, push? Like, even confused in that moment. But yeah, anyway.
I only say that to say this, that could be why you tore.
Maybe.
We don't know that to be true, but what we do know is the flow changed. My baby got here, but then the tear happened.
Yeah.
And the tear happened. Well, I guess you wouldn't. I remember this part because so Alea's out. Actually, I'm seeing her come through the birth canal, and I remember going back and forth telling you, she's coming, she's coming. And then Alea comes out. They grab her. They put her on your chest, and you have her. And I remember the nurse let me asked me to cut the umbilical cord. So I do that, and you hold her and all of that. And then they wrapped her up, and then they gave her right back to you. And you were holding her, and then you told me to take her.
I was about to drop her.
Yeah, you were like, take her. So I took her, and I was like, okay, cool. I didn't know that that's what it was, but I'm like, all right, cool. So I'm sitting on the couch, and I'm like, oh my gosh, my bad. I had this big burst of love and emotion I had never felt before, but I'm looking at her, and then I look up, and originally when I looked down, it was Nurse Ginger and the doctor. Those were the only professionals in the room. I look back up, it's like 10 people in the room. Now, they were all quiet. Nobody was freaking out, but I remember thinking to myself, all these people, they were just quiet and everybody was going on about their business and passing this and walking back and forth. You had kind of like knocked out, but I thought you were just asleep or like it was just so much and it was like, ugh. So I'm just holding the baby, and then it dawned on me, they're working on you. They're all in here. They start looking at screens. And I said, oh, something's happening. But I have the kid right now. But they not freaking out. So I didn't freak out, which they're probably trained to do that because if they had freaked out, I definitely would have freaked out.
Yeah.
But they basically got it together. They end up sewing you up, and they was like, all right. And I could tell it must have been better because I was holding Alea, but it was kind of like I kept one eye on her and one eye on the room at that point.
Yeah.
2 by 2, they would kind of file out and the room started getting less crowded over time. And so I was like, okay, whatever happened, because at this point we didn't know you tore, nor did we know how much blood you lost. So I was like, okay, whatever was going on must not be an issue anymore. But I will give it to them. Even in that moment, they did do a very good job of staying calm and doing whatever it was that they needed to do.
Yeah.
I have to give them that.
That part I have to rely on you for because I just don't remember much of it.
Yeah.
But I just remember her slipping. I didn't even have it in me to carry her much longer. I was like, come get your baby. Yeah. And then I think I blacked out after that. I was so happy to see her, but at the same time, I just didn't have it.
Yeah.
And then I think after that, I was kind of woken up a little bit because it was time to give Alea a shot. So we had to make decisions about her shot, all this other stuff. I'm going to pause it right here because I want to add something that we may edit back in. So when the balloon was pulled, something we didn't say, that spiked my blood pressure to high stroke levels, to the point where the same thing happened. They all kind of came in the room. Somebody started explaining what is magnesium. What is it? I forget what it's called.
I think it was magnesium.
Magnesium to us, and was like, hey, you're going to start getting hot. She put me on the highest dosage they could possibly put you on and explained so you don't stroke. It caused that much harm to me. So I do want to add that layer stress on top of the birthing of Alea too. So it was watching the blood pressure, and which made things slow down because they had to keep me on the magnesium. I just want to make sure I add that because I didn't remember that before. So that's just the birth. After that, by God's goodness, we made it to the room recovery space. It settled in for us that we were parents.
Yeah.
And I just remember doctor coming in saying, I lost 100 cc's more than what she's comfortable with. By now, when I'm walking, the smallest movements will make me feel like I haven't run a mile. It was tough. So I get to this place where I'm like, what's going on with me? Is this normal? And she was like, your body is iron deficient. So you need either a blood transfusion or an iron treatment. She was like, the thing with the iron treatment is it doesn't kick in for like another week or so. It takes a while.
It'll take a long for you to absorb.
Yeah, my body needed something ASAP. So we made the super hard decision. We prayed over the blood. We prayed over the process. We prayed over everything. Because you just don't know. Like, it could just be so tricky when you're doing a blood transfusion. But we decided to get one. I'm glad I did. Because my breathing and my body responded well. They just wanted to keep me a little bit longer just to monitor me. So Alea's pediatrician came in, was like, she's perfect. She can go now. But mom needed one more day. So she stayed another day. I remember my side really, really hurting before we left. Nurses were telling me, just your body readjusting. You should be okay. We pack up and go home. While we're at home, my body begins to swell. Nobody's business. And my mom is a nurse. She came to basically live with us for a little while to help me recover and also help with the baby. And we was like, okay, elevate your feet, elevate this, rest, sleep, water, this, that. And you're also trying to navigate pumping and all of this. So it was a lot. Sleep schedules and trying to figure that out. Quentin needs a rest too, so it was just a lot. My hips are already just naturally wide and thick.
Hippie.
Yes. But they were like engorging, like getting really big. A week goes by. And it's time for Alea's first pediatrician visit. And we go and, the pediatrician is talking to us about making sure dad feeds me and how Alea's still perfect. She's doing great. She's thriving. And I remember that day I didn't feel good at all, but I just thought it was just a part of the recovery. She said, Mom, you don't look good. Can I take your blood pressure? Would you mind if I took your blood pressure? And I said, no, I don't mind. And I don't remember the exact numbers, but I know they were in stroke level.
It was high.
Very high. It was very, very high at the time. She was like, I'm not your doctor. I can't tell you what to do, but I'm going to highly encourage you to call your on-call or your doctor and go straight to the emergency room. And that's exactly what we did. We get there. Now, my husband, Quentin, is such a trooper. He's so sweet. But I feel like it's only so much you can take sometimes. So he called my mom and was like, can you tap in? Because I don't know if I can take care of both of them. I need you to come help me with her. So my mom came and sat at the emergency room with me, and Quentin went home with Alea just so they could rest, And so the Lord is so good. This is another place I know he was with me. The hospital that we went to, it was packed. The emergency room was packed with a bunch of children, other parents. As a matter of fact, I heard a lot of complaining going on around me, how they had been waiting on a room. And so my mom and I prayed, and the nurse who took me in the intake was like, I'm going to go ahead and take your vitals. I told her why I was there. She knew I had just given birth. And she said, your blood pressure is still very high. She said, I want you to go into the waiting room and don't say anything. Just wait. And I said, okay. 30 minutes later, now mind you, I just heard them complaining. It's packed in there. She took me to the back and gave me a room. I actually don't know if I even realized how serious it was back then for her to even bypass me, or if that was just the Lord who helped me get to a space. But she had me do a urine collection and was like, let me see what's going on. She was like, ma'am, you have an infection. And I'm like, oh my God, what is going on? In the ER, their main goal, of course, is to get my blood pressure down, get the fluid off of me. One of the doctors that came in told me the fluid was on its way up my lungs. So they put oxygen on me, and she was like, this is because your body, the fluid is really rising here and it's causing an issue. She was like, but we're going to do some things to help you get it off you. So we did that. I think it was Lasix or something like that. So I had to kind of like urinate most of it out. And on top of that, I was still trying to pump. So like lumps were forming because it's like, hey girl.
Fluid retention.
So I think they eventually gave me a room in the hospital, tested my body, found out that I was dealing with E. coli infection. Quentin was like, E. coli, which is, it can be very serious. So I had to come from that. Then my biggest concern was my heart. So I had to get x-rays and all this. And so they end up keeping me for a full week to just bring me to a place of regulation.
This is the week after birth.
The week after birth.
Yeah.
When I look back at it, I'm so thankful how the Lord just kept me, because I don't know if our pediatrician would have said anything, if we would have even considered going to the doctor.
That's the part that's important to me. We walked out of that hospital only paying $200.
That's it.
Let me tell you loud and proud, we was on Obamacare.
Yes.
You can say what you want. My child is an Obamacare child. And the only reason we had to pay $200 is because Alea was ready to discharge, but Vanessa was not after the birth. They wanted to keep her one more day because of the loss of blood. And so that kept Alea in check as well. So that was the $200. If both would have been discharged the same day, we would have walked out of there zeroed out.
That's the biggest
blessing. One of the biggest was the Lord keeping us as well. Yeah. Open enrollment is coming up in November. All I'm saying is that Affordable Care Act, aka Obamacare, please.
Get that in your life.
Please. Every day of the week. To me, that was the Lord keeping us too, because you hear about the astronomical bills that people just have after having a child. But I do think the fact that you were admitted a week before just for the sake of monitoring the blood pressure, I felt like that was the Lord keeping us and keeping you. It was uncomfortable, but making sure that you were safe. Even after the yank, the harm that was caused from the doctor, and this also is not to say doctors are not proficient in delivering children and all the things. Our doctor, that particular doctor, was actually fantastic up until that point.
Yeah.
That is really the only thing. I would low-key, if we ever got pregnant again, maybe she's not the delivering doctor. But the care while you were still pregnant, she was top tier. Very informative. Nurse Ginger coming in because you having a C-section and the recovery, or even how much more blood loss could have potentially been. And Nurse Ginger praying, I felt like that was the Lord keeping us, because you did have to go on a particular type of blood pressure medication during the pregnancy.
Yeah.
It didn't harm her. It didn't delay her. That was the Lord keeping us as well.
Yes.
From even the doctor, the pediatrician that we chose for Alea, because we were looking for a doctor to do an alternative vaccine schedule where we want her to have all the vaccines. We just chose that we didn't want them all at one time.
Yeah.
And if people choose to do that, great. We just didn't want to do that. And it was difficult trying to find a doctor that was going to work with us in the agreement of, hey, we will get every single one of these that are recommended. Can we not put 5 of them in one vial?
In a newborn. Yeah.
It's recommended by the CDC. It's safe. It's just something we didn't want to do. And we were her parents, and we were looking for a provider that would meet us in a space of comfort and need. That's what we wanted to do. And so we found her. And she herself is a Christian. Her whole business
practice,
her and the other pediatrician is in there. They are upfront about the fact that they are Christians in this practice. So I feel like the Lord was covering us and keeping us, and put people who truly submitted to him and deferred to him in our path to help us on the way. On top of the fact that, yes, there was blood loss, there was harm, but you're still here. It could have been worse. It has been worse for other families, other women, and for other children. Yeah. And both you and Alea came through some trauma, but came through whole. Yeah. So I just feel like the Lord kept it. Again, $200 for the men folk out there. $200.
$200.
My older brother said they were still getting bills from, I think, my youngest nephew, like a year later.
Mm-hmm.
God, we didn't been had the child. What you mean a year later?
Still getting bills.
Getting bills.
It was a
So,
blessing.
yeah.
It was a blessing. Even my stay, the extra stay.
The initial stay, what word did we use?
What is it?
Before you gave birth. I just feel like the Lord kept us. I truly do. He covered us. And to me, it is a testament. I don't do as well of a job now on remembering and recounting that as I did then. It was definitely heavy on my mind then, and maybe even for the first year, but even just sitting here talking about it and reliving it, like, no, he kept us. Many things could have gone wrong at many points of time.
I remember we cried before we drove home with her the first time.
We cried?
We cried.
I cried? Oh.
On the way home, the ride on the way home.
I don't remember that.
But we cried. Yeah, I do.
I went 5 miles an hour, but I don't remember crying.
He cried. You cried, baby.
Oh, I believe you.
We were just giving thanks unto the Lord that we made it out.
Yeah.
Made it out. My doctor at the time let me know that it was probably going to take my body 8 months to recover from the birth and my body realizing it's no longer pregnant. I think it really did take just about that much time for me to feel normal again. But what I'm saying is, in the entire process, we were reminded over and over again that he is a keeper and that there are many other people who are submitted to him as well, who will help you along, that are in the marketplace.
Are in their field of specialty.
He has a way of connecting you to them. Yeah. Just be encouraged.
That's it. We ain't got no tips or tricks, but just to remember that the Lord is kind and faithful and he is a keeper.
Yeah.
Yeah.